I'd like to add my welcome as well. I'm Mark McClellan. I'm the director of the Duke Margolis Institute for Health Policy, and we are very pleased to be supporting this collaborative effort across Duke, the School of Medicine, the Duke Climate Commitment, the Nicholas Institute, for finding these cross-cutting solutions. And as part of my welcome, I would just like to highlight again the title of this event. It's Health Reform and Climate Change. But if you look at the slightly finer print, it's really about sustainability and resilience around something that people deeply care about, their health care and its impact on their health. So we're going to talk about these issues today from a lot of different perspectives. That's the point. The reason that we're undertaking these efforts at Duke, for those of you who are here in the room, I know we've got some strong Duke participation from our faculty, our students in this effort. For the many more hundreds of people who are joining us online, thank you for being here with us at Duke virtually. We look forward to your continuing contributions here as well. We're really trying to start a dialogue about how to find effective path forward on policy solutions for these important efforts. We have a tremendous amount of work to build on, but I know some diverse perspectives here. People do, though, consistently care about their health, the health of their loved ones. Their health depends on medical care, and so the more sustainably we can provide that medical care, the more affordable it is, the better. Their health also depends on their environment, and we'll talk about that as well. And so the more sustainably we can deliver health care from an environmental standpoint, the better for health. And health also depends on many other factors in people's communities, how good the jobs are, what the opportunities are to live a healthy life. And that's influenced by so many factors other than healthcare, so many economic and social factors. And we're going to try to bring those in as well, because we actually think there's some common themes that come out of this in terms of a path to move forward. So this is an opportunity for a working meeting. We're going to have a bit of time in the sessions today together for discussion and some questions and input from the audience who's with us today. For those of you who are here in person, we are breaking out for lunch table discussions to go into more depth. For those of you who are joining us online, like I said, this is a first event in on what we intend to be an ongoing effort to find effective policy paths forward related to health reform, climate change, and health system sustainability and resilience amidst climate change. And we're trying to build on all the resources of Duke and our collaborations around the state, around the country, around the world to make that happen. We will be hearing from a range of perspectives today, leaders in public policy and healthcare research, leaders from healthcare organizations who are struggling with these issues right now, along with, as Rob said, the challenges of healthcare affordability and access. So we're looking forward to getting that discussion going, and I can't think of a better person to start this discussion with than my longtime colleague, advisor, friend, I think I can say that too, Dr. Bill Frist. Dr. Frist is at heart, literally, a heart-lung transplant surgeon who became involved in public policy. You can come on up now if ready, and I hope you've got a microphone too, right? Okay, good. Became involved in public policy. We'll talk a little bit about that. I first got to know Dr. Frist in his time in leadership, got to know him well in his time in leadership in the Senate Majority Leader around the time of passage of major legislation like the Medicare Modernization Act, biosecurity legislation, public health legislation like PEPFAR, and has gone on to do a lot more after leaving government in terms of both private healthcare leadership and work on the environment. And Dr. Frist now, among other important areas of work that we'll also talk about a little bit, is the Global Board of Directors Chair for the Nature Conservancy. And Dr. Frist, Bill, as you've gone through these changes in your career. And what an amazing career with commitment to public health and improving health throughout that. And it's not over yet. That's what I was getting to. You seem to be just really getting going. So I mentioned Nature Conservancy, and for those of you who are following, those of the people who are following you online, they see a lot of interviews and sort of connecting to people that you're doing around climate issues, but you're also talking about healthcare reform issues. You're working on supporting some startup private companies that are trying to do healthcare differently, back to the point of affordability, access, resilience in healthcare. Tell me a little bit about how you're putting all this together, as your career definitely doesn't seem to be anywhere close to being over.
It's an honor to be here today. Many of you are here to learn and learn from each other, so really look forward to today.
Just making sure we got a mic.
My mic, do I need to turn it?
Mic good?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Let's just make sure we're.
Do I need to turn it on?
You may need to.
What? Yeah.
Yeah, I may just need
All the
to.
instructions were put it in your pocket. Don't touch it.
I think, yeah, I may need to flip that top. There we go.
All right, good.
Okay.
It's an honor to be here, and as I said, I'm here to learn, like so many of you coming in, but I did do 20 years in medicine doing heart and lung transplants, and that's a little bit of my origin story in terms of getting interested in nature and health and healing and climate change and impact, and then spent 12 years where we first met in Washington, D.C., and interesting journey. We did the sort of things you talked about, which opened up the world of the importance of policy. If your goal is to look at issues, broad issues of not leaving vulnerable populations behind, taking things to a real scale, great ideas, because we're all innovating, but how you take things to scale through the policy world. And there did things, and as majority leader, all issues, but did things like the PEPFAR, which is a fascinating story of pulling people together around these big issues that you do your best at in policy, but you don't know how big it's going to be. And it was big and continues to this day to have an impact. So learned a lot there. Medicare Advantage, and we can come back to some of these as we talk. But they're the importance of shaping based on what we know today, the best we can, not perfect coming on, but being able to iterate over time, and the importance of ongoing policy. And then coming out of there, sort of sat back and said, okay, looking at, I did a lot in foreign relations around the world in terms of medicine, mission relief in a lot of countries around the world, and then was on the Foreign Affairs Committee in Washington, then majority leader. And then I said, where can I start for the next 10, 20 years, spend time with that same thematic of service, hope, healing, well-being in the broadest sense. So to me, it's all the same, but it sounds kind of crazy jumping from all these. And then, as you said, entered the innovative world. And innovation, to me, is taking the best of the private sector, the best of the public sector, the best of academia, the best of the community, and putting it together. So focused on the private sector. Again, how you can use private capital to collaborate with others around these great ideas with all around innovation. This is sort of the venture capital and investment world, mostly around vulnerable populations, the populations that get left behind. And can you take those great ideas and take them to scale? And just like you can use policy in terms of the world of government and public sector, in the private sector, the quickest way to go to scale is having access to capital, surround about good ideas, let markets work, and take the very best of the markets with the public space. So that's sort of the journey so far. You kind of introduced me when my microphone was off and I couldn't stop you, that is over with, but we're right in the middle. Yeah. And the big issue for us now, which kind of brings it all together, is this huge issue that has not been well defined, and thus the importance of this conference and the discussions, and what will unfold over the next 6 hours or so, because I think we're really at the start of giving it definition of how the environment broadly, and climate being a change which we didn't have to think that much about. Well, I guess a long time ago, the ancient peoples had to think about it just day to day, but we don't have to think that much about it until the Industrial Revolution and what that has introduced. And then, and I'll close with this, is how does that translate down to you and me? And I was just camping for the last few days with my three sons who are 40, 39, 37, and their three children. And the fact that everything we're going to talk about today has an impact on their bodies today, you know, tomorrow, huge impact on the quality of life, their well-being, especially their, not especially, but in addition, their mental state, is kind of why this is important to me. Yeah. It has been important to me all my life. I think it's also because so many people we're talking to is how do people get, and I think everybody today will have some different story of how they got to where they are in terms of their interest. Mine, in large part, was my wife, who grew up on a farm and, you know, had natural experiences. And, you know, I've been operating every day, 7 days a week, doing heart transplant, lung transplants, and then lost my mind and went into the policy world and government in Washington, D.C. And then after that, spent more time thinking about the nature end of it. And then, but to tie it together, the first real impact of the importance of nature conservation broadly was I couldn't get the bronchial anastomosis to work. I could do heart transplants and had great results, like 95% success. And it was kind of cool in the 1980s because not many people had done them. And kidney transplants have been done since the 1950s, but I couldn't get the trachea, the bronchi, and kind of goes on down. Robert Tye is sitting there, you know, he's the expert in this. We'll hear more about that later. But I couldn't get it to work because we had to give steroids as part of our immunosuppression. And then in the early 1970s, a drug came along which really wasn't applied to transplantation of the 1980s, but it was discovered in nature. A couple of scientists from Norway were out in a big field, and they were looking for different plants. You know, 40% of all our pharmaceuticals today are based on sort of plants. And they came across a fungus, and the fungus, I think I have one slide that you can put up, no more slides, but one slide, and because I wanted to bring a picture of the fungus, and that fungus had these great properties that when we started applying to lung transplants allowed us to decrease steroids, and all of a sudden the bronchial anastomosis of a transplanted lung put in your body would heal. It all came from a fungus, a plant. The power of nature came in, and that was sort of my first real connection with the power of nature. And then other stories brought me specifically to climate change. I'll stop talking now because I know we got a lot to cover.
So this was great, and you know, connecting the impact that climate and diversity in nature has had on medical discoveries and some of the most advanced procedures that we're able to apply today safely and reliably to save lives. Yeah, I know your wife, you all spend a lot of time on the farm in Tennessee, and her concerns about changes in the environment there and all of that. It does seem like when you put together policy and private sector action, you know, those are hopefully can be aligned to help accomplish the same goals. You mentioned how private sector innovation has driven, you know, took those ideas from scientific discovery, sometimes accidental or in early stage research, and doing all the work that's needed to bring them to patients reliably. I see policy as having an important role in facilitating those steps. A lot of the things we worked on together were about, you know, how do we create the conditions that support and advance steps that help people live better lives while ideally growing the economy, maybe even growing it faster, like biotech innovation can potentially do. We're now trying to apply that in a very challenging area. The climate change, I know, seems to many people to be a big, broad change, and one where maybe there are trade-offs that you can't have the economic growth without addressing, you can't have the economic growth while addressing climate issues. You can't, there's trade-offs between people's health and environment. But I like the way that you framed, and this is my experience in policy as well, is it comes down to how it connects to each individual. And one of the things that we wanted to cover in this event today is what is going on that matters to people around their healthcare systems and the ability of their healthcare systems to both contribute to improving their own health and contribute to environmental sustainability. And in some of our discussions leading up to this meeting, it seemed like that's not really an either or. So there is a lot of pressure facing healthcare systems today to find ways to do more with less, to accomplish operation in less time, to make healthcare, primary care more accessible and cheaper at the same time. Could you talk a little bit about maybe some examples that you found in your work on climate, your work on private innovation, opportunities to put those together? And we've heard about the anesthesia gases used in procedures. There actually are less expensive ones that are much more sustainable from an environmental standpoint, but it does require changes in usual medical practices and the like, and that's what healthcare reform is about. Healthcare reform that makes healthcare more sustainable, accessible, affordable, and that contributes to healthcare having less of an impact on the environment. Can you talk about that a little bit?
Yeah, I think and we kind of touched a little bit, and this is a great place to start, because I think the thing we ought to do right now is get out there the sort of things we'll be talking about without going into too much detail. The why of climate change, and by that people mean different things, but the global warming that's going on, and the unstable extreme weather patterns, the acidification of the ocean, the wildfires, the sorts of things that we'll be talking about today, I think of in two big categories. And one is from the health system standpoint, the health sector, the 18% of our economy, probably 2/3 of it is sort of the delivery aspect, and 1/3 of it is pharmaceuticals and devices. And so you get along that bucket, which I think we should spend a lot of time with. And then there is this bucket of how climate change, the why, how climate change affects the individual. How you can go through the pulmonary system, you can go through the cardiac system, and as individuals themselves. And that's sort of the why. Why does it really matter? Well, some of my strict environmental friends would say, forget the people end of it. It's really the planetary health. And I can get that. But for me, who came through this tunnel with a lens of being a physician, who, when a patient walks in, there's nothing more important in the world of doing no harm, but lifting their well-being up from mental and physical. And that's sort of the why for me. But it's new, and it's new in many ways. It's new in Washington. It's new at the federal level for most people. I'll have to say as an aside, when I came to the United States Senate in 1994, 1995, there had not been a doctor in the Senate or elected to the Senate since 1928. And so when you have that much of our economy, health and healthcare and well-being, and in Washington there hadn't been a practicing physician in the 1920s, it's just mind-boggling. No. But the lens that I brought there, in part to PEPFAR and Medicare Advantage, was this lens of being a doctor. Not that anything's just different. It's diversity. It's biodiversity. It's why diversity is important. Even our United States Senate is critical coming in. And that lens, when I came to the Nature Conservancy, which is big, and I don't need to plug it too much, but I want to, but I'm not going to. But the Nature Conservancy is 6,000 people in 77 countries, and a budget's $1.5 billion. It's big, by far the biggest conservation group in the world. But the other thing, it has 1,000 scientists. And it has more scientists than the next 3 conservation groups combined. So, but when I came there was nobody focused on the health system, the end of it. And then I became chair of it, And then now we have a planetary and human health. So that's sort of in this bucket now that kind of merged the two together. When you look at examples today, and we'll talk through those today, but there's a lot of low-hanging fruit coming on, but to be able to identify those. The intersection with policy, you can think of in the Inflation Reduction Act, a bill that obviously had huge environmental sort of push behind it. Some of it is being re-examined today totally. But there are certain things in that bill that gave tax credits to redoing HVAC systems in both schools and in the hospitals. A lot of people aren't aware of that. But what is a way of using a policy, effective policy, to look at the air that everybody in a hospital breathes, the temperature in that hospital, how clean is the air, how clean is the temperature, when we know, at least in schools, probably 40% of every school has an outdated, ineffective HVAC system by today's standards. So having something like that, and that's just one example, that affects 3,000 hospitals, 4,000 hospitals is something that people don't know about, A. B, it was a policy coming in, but can make a huge difference.
Yeah, so we talked some about the policies that can get to less environmentally impactful procedures, less environmental impactful design of hospitals. I want to bring in some of the work that you're doing in private sector innovation where Bill, I'm going to oversimplify this a little bit, but a lot of your companies are really about trying to support new ways of delivering healthcare that use data and analytics and team-based approaches to basically make it more accessible and less costly, like for people living in rural areas.
Yeah.
They may have to drive a long way just to get to a hospital and where they don't have much access to primary care. So if you look at the health risk factors in our American rural population, much worse than many of the other segments of the US population. And a lot of these companies are about, well, we can do both. We can redesign the way that we deliver care that not just would do something like get HVACs replaced or get different composition of gases using anesthesia, but would just change the way care is delivered, that would keep people out of the hospital. It would avoid some of the need for those costly procedures. That would address something we've heard a lot about lately, better management of risk factors and heading off complications and
going upstream. I mean,
upstream.
And we'll talk about
health. It seems like it has environmental impact.
Oh, huge. Well, obviously, the less burden of disease that requires health delivery system, sector, hospitals, supply chains.
I would say the greenest hospital bed is the one you don't have to build in Stafford.
That's right. And I think you mentioned a couple. So that's where we specialize, basically. Bring in private capital who understand whether it's the misuse or overuse or vulnerable populations, and we'll come to that over the course of the day, vector-borne diseases and what climate change is doing to it in terms of the range of whether it's insects or transmissible sort of vectors that are out there today coming in. And so that's really important. I spend a lot of time coming in, like you mentioned rural health. There are 50 million people, 50 to 60 million people using federal standards. And that's a lot of people. And they have more chronic disease today. There are greater healthcare disparities. They die earlier. The maternal and infant mortality is 25% higher than everybody else. And so what we did, we said, what from a policy standpoint has worked in the past? This is upstream now, for the people who have more lung disease, and then you think of pollution and what climate change does to pollution. It gets exacerbated. So the incremental impact is greater in this population than in the other 250 million people. So why not focus on that? Have past rural health programs been successful upstream? Not really. Yeah. And so in the public sector, I love, as you know, spent 12 years there, but it moves slow and it is really hard. And that's why centers like this are so important, to get the data, to get the analysis out there to influence that policy, but that takes time. Being a surgeon, I like to cut, sew, fix, transplant, take the heart out, put one in, and that's my life. And so what we did is we went out and started a company, and the company is really pretty neat because we're in about 1,000 communities, 1,000 clinics, and culturally sensitive to the community itself, and it focuses on chronic disease.
And you draw on staff and participation from those communities.
Yeah,
people who
in fact,
are known and
and
trusted
the
there.
people who are navigating that are not people from Washington or people from white coats out of Nashville, Tennessee, but it's somebody from that community that is hired and trained in an effective way to be the navigator for that patient coming in. Policy is important because that would not be possible without a Medicare Advantage program that looks at healthcare, parts of it in a more value-based way, where holistically you can look at a patient and say, is it mental health, is it physical health, is it non-medical determinants, is it social determinants, is it they eat too bad foods coming in? And so what we can do, and it's been hugely successful, is come in. But it took an idea, lots of ideas out there, we have to go to scale. It took marrying with policy, Medicare Advantage, the program there that basically kind of looked at it from a value-based way. And then it looked, not for everybody, because it's hard to do stuff, treat 350 million people. It's hard to treat them with the same programs, which is important to in the big structure, but it's hard to target. And the private sector can move fast, it can be nimble, it can get capital, it can iterate a lot faster. If things aren't working and you're in 1,000 communities, within 60 days, you can change the model coming in. And a lot of, if you're in the pure Washington, D.C. public policy, sometimes there's not that much appreciation of what the private sector can do. And if you're in the private sector, you kind of, a lot of times don't care about the policy. You just want to kind of go out and someone just want to make money and all. But if you put the two together, you got powers, you got synergies, you got things happen that solving problems that you just couldn't imagine be solved.
Yeah, that is a great point, and just would highlight that this is how policy and private sector innovation and insights. By the way, it's not just for-profit, but most of our healthcare system is nonprofit. There are a lot of people here at Duke who are working on good ideas and insights that can help address exactly the problem that you're talking about. I had a chance to speak with my successor at CMS, Dr. Mehmet Oz, recently about this whole issue of helping get data to people and their frontline healthcare providers, and he talks about teams just like you do. It's not just the physician, it's the community health worker that's local, and it's the data and technology behind that to identify people who are at risk, to make sure they're informed about those risks, and to make sure they get help in knowing what evidence-based actions they can take to reduce those risks. And that's made possible by paying in a different way. This, as you said, paying more at the person level and paying attention to outcomes. I would say, though, that most of the work in that area, Bill, has focused on identifying chronic disease risk. We've had rising, you pointed out, it's particularly challenging in rural areas, but rising chronic disease risks. We're also seeing, and unfortunately in North Carolina, as we'll talk about later today, rural communities that are facing bigger impacts from climate events, heat-related changes, extreme weather events like Helene. That was we're almost at the year anniversary of that, and we've got 2 other hurricanes off the east coast of North Carolina that are causing shutdowns and access issues related to people with health risks. By focusing on identifying people who are at higher risk and providing that kind of personalized support, it seems like there should be a way to make healthcare systems not only more resilient from the standpoint of engaging individuals and moving upstream, but hopefully more resilient in addressing these changing health risks that individuals are facing across our country.
So much of it is message, which I think, again, getting the data analytics right. Messenger, who is the trusted messenger? It always happens. Climate is weaponized. Even in my short time in the political world, from when I started to when I finished, it's gotten sort of a lot worse in that people, I know weaponized is probably not a good word, but more isolated, more you're in that category, you're in this category. And I think message is really important, which we're developing. And I think to personalize it, which this administration, as you pointed out, at least in the 3 administrations or 2 administrations I served with, there's more concentration on this personal information, getting out, getting it right, accurate information. And part of it's controversial in terms of discussion, but the personalization of it is there. And I think we're doing the same thing there. The messenger, I think, the health sector, we're going to hear from the leaders today, but the health sector, as 18-20% of our economy, has not historically been as active when, whether it's 8% or 10% of the bad bioemissions come from it, but it's in the business of healing, health and healing. And I'm pointing the finger at myself here, but just one quick example. I'm on the board of a large health system that is not based in Nashville, but it's an interesting system. And I kept bringing up at the board meetings climate and nature and all that. And it's a great group of people, And they'd say, okay, there's Frist again talking about the heart and the lung and all that. And I'd come back to the next meeting, and at the board meeting, I'd say at the end of it, but what are we doing since we're putting 10% of the bad stuff in the air, which is killing people, no question about it. What are we doing? And they say, oh, Frist, if we just appease them in some way. And finally, they said, okay, let's have a little committee and look at it. And it was so interesting as you sat around the board table. And as each of the 5 people who reported out of the vector-borne diseases, Legionnaire's disease that's coming in, a lot of these clinics, a lot of these hospitals are along the coast. So hurricanes, so you don't have to be on the coast as we've seen overall, but the hurricanes and the flooding, the HVAC units, which I mentioned coming out. Yes, we've noticed in the last 5 years, we've had to replace more hospital HVAC units than we ever have in our history overall. And yes, so things must be, being strained a little bit more. By the end of that conversation, you had everybody shaking their head. This is something we have to focus on coming forward. So a part of it is the awareness, getting as good a data as we can and sharing that, which obviously that's what this conference, this symposium is all about. And then it appeals to people's better angels. There's no question about it. If you get the message, you got the right messenger, and you have the right data and analysis. And if you get it right at that level, at the people level, and focus on, it could be 20 million people, it could be rural health, it could be 50 million people, 100 million, that'll filter up to Washington as well.
Yeah, that is how you put together effective policy leadership, effective private sector organizational leadership. I did want to bring in, and this is a little bit of foreshadowing what's coming the rest of the day. In addition to your work with the Nature Conservancy and these private sector innovations make healthcare more sustainable and personalized and help empower people and support them in dealing with their own personal health risks, which we've talked about, are evolving. You've also done a lot of work with the National Academy of Medicine. We have Victor Zhao with us today, coming up to talk about some of the work there. Now, I don't want to steal his.
Let's take all his thunder. That's right.
But somehow I think Victor's going to have plenty to talk about. I've never known him to be otherwise. But how is that? Anything you've taken away from that work that you'd like to highlight as we kick off today and get people thinking about these issues?
Most of what I do driving obviously comes, my dad was a physician and my brothers were physicians, so being a doctor is important to me, from lifting every individual up. But coming in and having the message and the messenger come from things like the National Academy of Sciences and the Institute of Medicine, which is the trusted messenger of the largest sector of our economy today, healthcare. It pulls in physicians and doctors and, the million of those that are out there. It pulls in the 5,000 hospitals. It puts it in the outpatient care. But most importantly, it comes back to fact, to science. The best and every country probably says it's got the best science, but we still have the best science. So to be able to have a fact-based, trusted messenger is a opportunity and a privilege. And to have somebody like Victor leading it, and this is not, let's be honest, this is because you start in these categories. If you're either you either believe in climate change or not, or environmentalist or not, and all that. That's where we're starting from. But to have the National Academy of Sciences and Engineering and Medicine sort of coming in and saying, these are the facts, let's collect the data, and then we're not going to give the answer, but we're going to pull people together in ways that are unique, that are consistent, that are trusted, that are inclusive, that respect diversity, and we're going to be out front helping define it. That's pretty cool.
Very, very important, and Victor and I have talked about this before too. The National Academy has been there for to drive some other important movements in healthcare, where I think kind of Bill followed the same principle of, well, that seems like a problem, but it seems too hard to solve, or we can't do these two things at once. And one really compelling example that Victor's really informed me about was the patient safety movement, which started out as calls from sort of one part of the health sector that felt like we just weren't paying enough attention to things that go wrong far too often in medical care. And remember, the initial reaction then was,
doctor said, we don't need,
we don't need, like, we've
that's
got
a lot of trouble.
We
know.
Yeah.
No, that's right.
And as that, as the evidence accumulated, and as connected with people, connected with policymakers who said, hey, these seem like important things to measure, as well as did the patient just get through the operation itself? What happened next with other complications and additional costs? It turns out the two were kind of matched up, that the more you did to address patient safety and have reliable systems in place, the more that you contributed to an efficient, less efficient healthcare system with fewer adverse events. We're also joined today by John Perlin, the Joint Commission, who's also working with some of these National Academy efforts and with us on a range of issues, including the effective ways of using AI in healthcare, for example, where some of the same issues come up. It does seem like there's an opportunity to build out more facts and evidence, and I know you've been working some with John over the years too, but any comments about building this in systematically with the Joint Commission now focusing on better ways to help make for sustainable, effective, affordable, reliable healthcare system?
Yeah, I think those two examples, again, we're going to be talking about it over the course of the next 5 or 6 hours, but really are examples of representing the field itself of science, of medicine, of health, being a voice, being a leader, because it is science-based. And some people say, well, science, may not believe in science, but most people today will recognize this trajectory of progress is based on science that we have in the history of civilizations coming in. And then taking, exactly as you described, like with the patient safety, what may not seem, if you just take a little piece of its significance, it might be falls in a hospital. It might be, you might say, well, I need to record those, and it's kind of a chore to record those, and it's rare, doesn't happen very much. But you take that as an example, but you combine it with about 100 other things like that, and then all of a sudden you collect the data, you say, this is really significant. This is impacting not just the world and not just the planet and not just the health of the soil and the clean water and all, this is impacting me. Or if I get sick, and everybody gets sick, and sometimes if I get sick, this is really important. And it educated the professional community of healthcare and healthcare providers, but also to the benefit of patients coming in. And I look at it a lot because right now we're still in a real siloed world when you talk about, if you mention climate change, people, initial reaction, they just go to a bucket, or they don't want to hear very much more. If you start talking about the health and the healing and your life and the life of your kids and the well-being of your grandkids, all of a sudden, okay, well, I'll pay attention to it.
Yeah. We are going to get to some other challenging issues that turn out to have climate connections too, maybe in the same direction of opportunities to do both, to address these issues, move forward. We've talked about healthcare affordability already. Resource intensity tends to go along with environmental impact intensity. We've talked some about community health and community resilience. We're going to hear a lot more about that and what innovative healthcare organizations like some of the ones you support, some of the steps that are happening here at Duke and elsewhere, and that policy in North Carolina and elsewhere is trying to support are taking place. We're going to talk about supply chains, a big part, so healthcare overall, close to 10% of emissions accountability in the U.S. A big chunk of that is supply chains, and something, a term that I gotta say I wasn't an expert on before getting deeper into this work, and certainly most Americans probably haven't heard of like Scope 3, which people kind of view as, well, that's happening, outside my organization. I can't do much about that. Turns out maybe you can, both directly in terms of the resilience or the environmental impact of the suppliers, but also, back to our earlier point, if you're using less intensive care, fewer procedures, fewer devices, less impact as well. These are all challenging issues to deal with. One of the things I've really enjoyed working with you on over the years, you take on these big issues, whether it's the lack of access to any kind of effective HIV therapies in Africa, something that truly motivated President Bush, and working with you and others of us on what turned out to be a bipartisan effort that is evolving, but still very much important today as we get to even better treatments for HIV. You mentioned Medicare Advantage and trying to make healthcare more focused on people and moving care upstream. Still got work to do there. Biosecurity. These are tough issues. How do you keep the optimism about it? There's going to be a tough one to manage as well in a very sensitive environment.
And I will say,
words of advice?
I will say about this topic, I'm really optimistic, and I'm optimistic. First of all, you mentioned PEPFAR. People said it was impossible to address global HIV/AIDS. It was too expensive. It cost about $10,000 a person to teach people or to treat one person with antiretrovirals at the time. So people just said, we can't do it. It's impossible to do. But by pulling constituents together, using mainly communications and trusted messengers coming in, and pulling the science together, you knew that you could drop the price from $10,000 to a couple of $100 and now down to $100 or so. But there were 3 million people dying every year, 23 million people with AIDS around the world. The United States was not doing anything globally, nothing. We were talking about it, but we weren't doing anything. And by pulling in the various constituencies, same kind of thing, you got these silos, and you got to pull them together. You got to pull the evangelical community in, the far right coming in, the far left, the progressives, the entertainment industry. But if you get them to come to the table, the sort of better angels that I mentioned earlier do come out, and you can make huge progress to the point there are 25 million people alive today, everybody agrees with this, that would not be alive without that one program. And so when you see that one time, and you are on the inside of it, and again, being the only doctor in the Senate, if things would come to me, and so I had the opportunity to participate in it, you basically say these big things are solvable. I don't know what solvable means, but you can make huge progress. And I look at this a lot in the same way coming in. So if it's science-based with the data, a lot of what you do here in collection over time, if you have a way to go to scale, whether it's private sector or public sector, or ideally putting those two together, and the alignment coming in, which you can do by this, get business schools and law schools and medical schools and clinicians all together, all coming together, and align them around a common goal, and people will come at it differently. Jesse Helms here in North Carolina had written an article, either the Washington Post or New York Times, I've forgotten which, about HIV/AIDS. But the federal government should not be involved in fighting that. It's a moral issue. And within about a year of me and Bono of U2, I mean, a strange bedfellows coming in, and he was a good friend of mine. He was chair of the Foreign Relations Committee. But when we talked about the 10 million orphans that existed, because they didn't have access to a dollar drug at the time, Nevirapine at the time, $1 a day, Jesse basically said, I'm on board. And he became our biggest advocate for it. So even these impossible, insurmountable things, if you bring the right people, that is science-based, that is fact-based, you get the policy right, and you give a vehicle, you couple it with technology like the pharmaceutical companies who said, yeah, if you give us enough time and support us, we can lower the price. And when you see that thing, that sort of thing one time, it really inspires you and keeps you motivated. Optimistic here, 10 years ago, 12 years ago, all the projections were that by 2100, it would be a 5-degree centigrade above pre-industrial levels. Well, we haven't made a lot of progress, but we've made some progress. And so now all the predictions, it'll be 2%, 2.5%. That doesn't sound like a lot, and 1% of 1%. I know we're sort of near a business school. We're in a business school, I guess, but you don't want to take percents of percents. But to go from a 5% prediction to a 2.5% prediction is pretty good coming in. So the progress, and then the technology. We have technology. We have AI, which we'll talk about today. We have technology which is unheard of today that 5 years ago we didn't have, and the technology applies to pulling carbon out of air. It applies to the sort of the efficiencies that we can make appliances with today, and it applies to the things like the nuclear world of nuclear energy, where technology with small modular reactors, we can get a 24/7 supply, completely green, online 97% of the time to cut back what the needs are in the future. So I don't want to get too excited about it, but I think we have huge opportunity in the next 10 years.
Well, Bill, Dr. Frist, I want to thank you for kicking off this conference. We're going to be back up on stage together later today to reflect a bit on what we've heard, the ideas that come out of the discussions that we're having today. And I do want to end by especially trying to endorse your note of this is a really hard problem, but boy, there's some really good opportunities to try to make progress. Thanks for kicking us off today.
Great to be here. You bet.